Greetings and welcome to CE Institute. My name is Selena Belisle. I am the founder and one of the instructors here. And today I'm going to share with you the beginnings of one of our medical massage courses. Throughout the course, you'll hear me reference things such as I'm going to show you this later and so forth. That's because this is the introduction to a longer course. But whenever possible, we try and share some of our training publicly for free on YouTube so that people who have taken our past training can refresh and see it over again here on our free YouTube channel, and also to give our potential students a taste of our training to learn a little bit more with us. So hopefully they'll sign up for more training. So without further ado, let me introduce you to one of our subjects here at the school. We are going to call today's training medical massage, but it's also commonly referred to as clinical massage and evidence-based training. In today's class, I'm going to show you how to look up research online and for free. So you don't have to take a continuing education class every time you want to learn something for massage. In research, once you have that medical background of what worked and what didn't, you can use that research to guide your hands-on massage applications, approaches, principles, and practices. I personally see the terms medical massage, clinical massage, and evidence-based massage as interchangeable. All three of these should be using research to practice. They should be these evidence-based research methods to treat different medical conditions of the body. And in our case, it will be through massage. This medical evidence can show which massage techniques and routines were effective in treating various medical conditions, such as headache or migraine, constipation, geriatric or prenatal conditions, pain, stress. All of this can be treated through massage, and we're going to use research to find different practices and routines that were successful. And in research, we can also see which practices and routines were not as successful as well. Now, just because I'm going to show you how to attain all this research for free, which you can practice from, that doesn't mean it's going to replace things like taking specialty training for oncology or prenatal massage. Or if you want to, those are specialized groups. If you want to do specialized service like hot stone massage, you would still need to. We teach all of those specialized massages here at the school: prenatal, oncology, hot stone, and more. However, when we're teaching, we cannot cover every possible medical scenario that it's going to present in your treatment room with your particular clients. So what's nice about medical massage in today's training is once you learn how to look up for free in research what might be used in the select clientele with the demographics of your particular client, you'll have an added resource of what might have been successful for that population, and more importantly, what was not. So once you've completed your specialized training, whether it's just Swedish full body massage and you're trying to provide stress relief, or if you are working with oncology clients, once you've completed your oncology training and you have all these oncology clients coming to your practice, and some will present scenarios that were not covered in your original training, whether it be with us or another oncology education provider, then you can look up in research and see what's been practiced and proven and successful with that foundation. You know from your training what's contraindicated, what you shouldn't do, the indications, and more. And from research, your goal is to take the hands-on protocols, the hands-on methods, and apply them to your client with that educated knowledge. Your job in medical massage or clinical massage or evidence-based massage, whatever you want to call your practice, will be to simulate what was proven in research to be effective on your own treatment table. So hopefully I've got you all excited right now. Wow, where can I get all this free training resource, right? And there's lots of places that publish research, but we like pubmed.gov. That's the URL or website address. If you just type pubmed.gov, pubmed.gov. So pubmed.gov. That is the National Library of Medicine. Okay. And it's paid for by your American tax dollars right here. So when you want to look up research, you can do Google Scholar and other websites and so forth. I feel like pubmed.gov is less biased. It includes research from all over the world. If there's something published in a medical trade journal or magazine, it usually makes its way to pubmed.gov. So sometimes the research studies are translated from foreign languages. You'll see something that doesn't necessarily make sense. Look at the authors, try and look at the trade journal. You'll see it might have been a trade journal from Spain or Greece that it was originally published in Spanish or Greek, but they usually have an English translation on the pubmed.gov site. It's a great site to go to. PubMed.gov includes thousands of massage-related, hands-on, researched protocols and methods with various medical conditions and various populations, geriatrics, people who have non-specified low back pain, and more. And then when you take the different modalities that are within a massage therapist scope of practice, and I'm talking anything under the sun because there's a lot of practices out there, right? We have trigger point, myofascial release, neuromuscular therapy. Those are specific therapies. Then you have populations like geriatric massage, oncology massage, pediatric massage, and you have rarer modalities such as Rolfing and S-salon work and so forth. If you look up all those different modalities in addition to general massage, there's probably over 1 million research studies that have already been conducted for all these different hands-on methods. And a lot of that research is published in one central place called pubmed.gov. Now, it's really important once you get access to all this free research that you don't just take something from research and attempt to practice it. We do have some parameters here, and we're going to discuss that throughout this training today. What's really important is that you try and find research that is within your own scope of practice, or also known within your own wheelhouse, right? You don't want to be trying to learn something from a piece of paper written in a research lab. You want to take things that you already know and apply them to your own practice. Let's go through how you would look up that research on PubMed, what you're looking for so that you can apply it. This is what PubMed's website looks like right here, the National Library of Medicine. You can see that at the top of the blue banner here. And in the white box, right underneath the words PubMed, you'll see a white box and then a green search button to the right of it. That's where you're going to type what you're looking up. And let's say you already completed geriatric massage training, specialty training, but you have a geriatric client that's coming to see you for constipation. And they have low back pain and their tummy hurts because they're constipated. And your geriatric massage workshop did not include geriatric massage for constipation. So once you're trained in things like geriatric massage, you've learned the basics, such as what postural hypotension is, where at the end of working on a geriatric, you'd want to help them sit up and sit there a moment so that they don't faint when they dismount the massage table, right? You know these things, but you didn't get how to relieve constipation in your geriatric training. You can type that here at PubMed And it's just like a regular Google search. So geriatric massage constipation in the search box at PubMed comes up with 7 research studies about how to relieve geriatric constipation. Can you believe that? It's so specific, but we have these researched methods right here, 7 of them. Now, some of them might only be abstracts, some of them will be very vague and not share much information at all, and 1 or 2 of these might be republished, so it's showing here more than once in different publications. But there is some really specific researched methods that you can find on PubMed, things that you might not have ever thought of before. And it's wonderful to get all these free resources about how to back up your hands-on practice, either apply new approaches, or you can look up and say, hey, I'm already doing that, and have that affirmation that you are practicing true medical massage. You're practicing something that's researched and hopefully been proven to be effective. Once you find what you're looking for at pubmed.gov, then you'll look at the research study and make sure that the population is the same as your client. So if you're trying to relieve constipation in a geriatric person, and the study is for pediatrics, and somehow that came up in your search results, obviously that's not the same population. What works in pediatrics is probably not going to work in geriatrics, right? Very, very common sense, but I got to throw that out there. How many times have you guys Googled something and something completely irrelevant popped up, right? Well, the same can happen at pubmed.gov. So make sure when you find researched methods that are similar to what you would like to do with your specific client, it addresses your specific client's needs. Make sure that the study population is around the same age as your client or group. Maybe it's diabetics or something like that. The same gender is important. Maybe they only studied men or women. Okay, so that can happen. So make sure it's the same disease. Sometimes headache relief might show up in a constipation study. Who knows why these random searches result the way they are. And the severity too. There are headaches and then there are migraines, which would be considered more severe, right? And also you have low back pain. You might have something acute that's been lasting a few days versus chronic, years and years and years. Somebody who's in severe pain versus mild pain and so forth. All these different details of medical conditions and situations should be published in the research study. They're usually published in quality studies. Some lesser quality studies might not have that amount of detail. And sometimes there's abstracts or a little blurb of the study, and they might ask you to pay to view the whole study. That can commonly happen too. I usually just try and look through the free research. There's millions of research studies on pubmed.gov, so I can usually find something that says free that I can click on and read. So again, your evidenced or medical massage practice would be to try and find some research studies for your particular client's needs, these researched methods that were proven effective, and try and simulate whatever was done hands-on with your client, as long as you're already trained with whatever skills they're asking you to apply. I want to make a caveat here, and that is sometimes you will not find the exact same study population as your client. There might not be a 27-year-old male obese with this particular problem that was studied, in the 20s. But if you find similar parameters, that's what we're looking for. It doesn't have to be exact. So what I want you to do in medical massage practice is definitely look up the research. Try and find researched methods for your particular client that had successful treatment outcomes. The client's constipation was relieved, or whatever you're seeking to help your client with. Then you're going to make sure that the group or population that you're working with, that research, fits the same parameters of whatever your client is presenting. And I want to give you an example for a moment. Let's say you have a surgeon who does knee replacements, right? An orthopedic surgeon. And he has a 52-year-old female present with diabetes who needs a knee replacement. If he's never seen a 52-year-old female diabetes and he can't find this on PubMed.gov, do you think he denies the appointment? Of course he doesn't. Sometimes people are not going to fit the exact parameters of past experience or what's been researched. That's okay. As long as you don't have any contraindications why this shouldn't be done in your base rudimentary training, and you've read the entire study and it makes sense, it would be appropriate to apply your client, that would be fine. We're not robots. We don't have to follow this, exact parameter, or else we're going to melt or dysfunction. And our clients aren't all the same either. Sometimes we have to be flexible in using some of the research out there. So to be clear here, to practice medical massage, you are going to look up research protocols on PubMed.gov, and you'll look up the various medical conditions you're trying to treat. There might be some slight variables, such as the average population was 40 years old and your client's 20 years old. That's a slight variable that I can accept. The variables that wouldn't be appropriate to accept is if you're working with a little bit higher risk of a population, such as your oncology or geriatric or prenatal clients, and you have a researched method that was done for people that weren't at a higher risk. They were normally healthy but suffered from migraines or something like that. I might think twice about taking that method, especially if it's aggressive and hands-on protocol, and applying that to a high-risk population such as the prenatals, geriatrics, or oncologies. Essentially, at the end of the day, and depending on how much hands-on practice and years you've been at your trade, you're going to need to make the determination when you can apply some of these research protocols to various clients and when you can't. Slight variables are okay, but taking something that was done on athletes and doing it on grandma might not be the best practice. Now let's review the language that you're going to see in the research studies. These are the basic elements that you need to know to make sure that you can interpret what they did hands-on, the researched evidence methods, that you understand this so you can properly apply it. Some of you will already know these basic terms, but we're going to review them together to make sure that we're all on the same page for when we apply our hands-on practice later, so that you can perform medical massage or clinical massage or whatever you want to call it. They're all interchangeable with the same researched methods that we're going to teach here. So in most healthcare research studies, you'll be provided basic information about what happened in the study. The title is usually pretty clear about what they studied. And you'll see subjects or participants noted in a healthcare study. Your subjects or participants are those who underwent some type of, first they go through and determine if they're a candidate, if they're indicated for whatever service is going to be provided. Sometimes they'll be denied service immediately because they're contraindicated, and that should be a statistic listed within the study. They had, 1,100 people that came forward, and they provided service to 900 because 200 were disqualified. Those are your subjects or participants who would be similar to our clients or customers. Method in this study would be your hands-on application when it's these massage and bodywork studies. Now, sometimes you're going to look at a study and it's only going to have an abstract or a small portion of the study, and it might not include the hands-on application methods. Sometimes publishers of this research will charge you a small fee, anywhere up to, the greatest I've seen is like $49, to view the entire study. And the methods might be in the paid version, so you can see the whole study instead of a little synopsis, almost like an advertisement of the study. Some studies are free. Others you can pay for, but I want to tell you right now, paying $49 to view the entire study does not guarantee that you're going to see a hands-on written protocol in the study. Some protocols are documented very well in research, some are not. Even the expensive paid articles don't always have a clear, detailed hands-on protocol. So my recommendation would be only look at the free studies that you don't have to pay to view, because there's no guarantee that if you pay to view a study that it's going to have the hands-on sequences that you might need to achieve the same results with that researched method. What I've noted after using PubMed for almost 20 years myself personally is that the more recent studies will usually have better documented methods, paid or unpaid. A lot of the research published at pubmed.gov is free to look at the entire article, but some of it you do have to pay for. And even if you pay for a 2024 research article, it's not guaranteed that the methods will be there in the steps that you're looking. So again, my best recommendation is to look at the free research. And there's usually enough studies to sift through to find hopefully what you're looking for. Sometimes the studies that you find on pubmed.gov were paid for by the US government, your and my tax dollars. And to me, those are some of the best studies to review. So during COVID, there was, I think, something like a $600,000 grant for myofascial release research to show the efficacy of myofascial release. I think it might have been with back pain or various medical scenarios. I would have loved to pick up the study. I just didn't have time to do it during COVID. There were other obstacles, but to me, those are the best types of research studies to look at. They're usually highly objective. They've gone through lots of scrutiny to get published, to continue to receive that government funding, and best of all, they're free. When the tax dollars pay for those studies, they have to publish them for free, and we get lots of valuable information to improve our medical practice. Now, when you do find researched hands-on protocols, there are a few restrictions for using them. If you do find those hands-on protocols, but you don't understand what's written, it's probably one of those researched methods that was published in a foreign language and the translation wasn't great, so now you don't understand even which direction to work. And we don't want to use our clients as guinea pigs and guess which direction we're supposed to work. If it's unclear, you probably shouldn't use it. If it's too difficult to understand, there's words or language in there you don't understand, don't use it. And of course, you would never work outside of your scope of practice. And I'm going to give you an example. We teach orthopedic cupping here at this school, which is pump cupping. So we have a pump that we put onto the plastic cups, and then we pump, pump, pump to create reverse suction. Another method of cupping is fire cupping, where you would literally take a cotton with alcohol, that's how we're taught to do it in China, and you would swirl it inside of a glass cup, remove it very quickly, and put it right on the skin. And sometimes if there's like a drip of alcohol in that glass cup and you put it directly on the client's skin, they can be burned. And that happened at the Beijing hospital in China, where I was trained by one of the head doctor or something like that. So I wouldn't necessarily take a fire cupping application and apply that with my suction cups with the pumps. It's not really the same application. And fire cupping is usually applied along the meridians, where pump cupping is usually a musculoskeletal application. So if fire cupping is outside of your practice, and I think there's some state boards that are prohibiting this practice because they do not consider the use of fire within the scope of massage therapy. I think that's going to broaden across more boards throughout the years as more and more people are burned. I did see a very bad keloid scar on someone once who had fire cupping, and We show it in the training, our cupping training of, why you shouldn't experiment with it, why you need to do professional training. This is an example of an injury that can happen when you're not properly trained or when you're working outside of your scope of practice. So you might find some really interesting research studies, but it's not something you're really trained in. Please don't do it. We don't want anybody to get in trouble or injured here. No, I don't want to discourage anybody here. Usually when you can find the researched methods, the hands-on protocols and sequences and so forth, they're usually fairly easy to follow as long as they're within your scope and it's something you're already trained in. Some of those hands-on protocols and methods will be concise. It'll tell you to do which step in which order for how many minutes and so forth. Some of the research studies will be vague. When they're vague, I simply improvise and do what I already know in addition to the hands-on routine that I'm seeing from research to provide a full appointment for my client when I'm already trained to work with that population or disease. You're simply going to use your best judgment when you're practicing those hands-on protocols. And remember, there can be slight variables. There might even be something that you're not comfortable doing on that client. Just remove that step. You can probably do the others, but the outcome might not be the same as what was researched because you're removing a step. You should be using your existing training to make sure that you're doing no harm for the client. And then that research is going to supplement your training. It's going to give you additional ideas, hands-on methods, sequences, timeframes, and more to provide a better enhanced treatment for your client. Here are some things for you to think about when you're practicing from research to provide your medical massage. There's a really large range of quality research studies that are published, okay? And particularly on Facebook, I've seen a couple therapists simply dismiss studies when they feel that they weren't quality studies. And I think that's the wrong approach. Okay, when it comes to massaged hands-on methods, we have a lot of research, but it's not as much research as the pharmaceutical companies publish, okay? So I think when you're looking for free resources, we can't be that picky. Also, as long as we're trained to work with those diseases or clientele or whatever your subjects are and their particular needs, and you can comprehend the study and you feel like it's going to do no harm to the client, there's usually no risk in trying the researched method as opposed to what you're usually using, as long as you don't see that, there could be any harm from it, okay? So we can usually test the quality of the study right away on our clients. You shouldn't be using them as guinea pigs and doing something you don't know how to do. But if you can follow the study, again, it's easy to provide. Maybe what you're using isn't working, which is why you researched and tried to find a different method for your client. There's usually no harm in trying it. And if the client found an effective relief, you had a good treat outcome from those methods, you know that the research study is the one to use. If the client didn't find relief in whatever the research method was, you can look for other research methods. So it really is a great tool to practice medical massage from research because it gives you greater options than what you might have only received in a weekend workshop or something like that. And please keep in mind that not all clients will have the same favorable responses. Even in the research studies, you'll see things like 38% had a favorable response. Maybe it was increased range of motion to this degree or something like that. Sometimes it might be 50%, 80% had good outcomes, whatever it is. Your client might be one of the ones that has a good outcome. They might be one of the ones that has a poor outcome. We never know until we try it, right? So just, make sure that whatever you're doing is safe for your client, you're trained to do it, and then you should be good. There's a fine line between practicing from what you found in research and continually checking in and evaluating your client, especially when you're doing something new with them, to make sure that they're comfortable and it's appropriate work for them. So when you practice something new, especially a researched hands-on method, make sure that the client feels comfortable with it. You're not doing anything that is a new experience and doesn't feel good to them. If you are practicing from research and you're seeking a certain treatment outcome that was achieved in research on the majority of the subjects, you should try and follow that research protocol in its entirety. Okay, so the research protocol was done in its entirety to get that treatment outcome. When you start adjusting your treatment protocol, the published researched method, that could adjust or alter your outcome, obviously. Sometimes I've looked at the research protocols and I'm like, oh, I don't want to do step 2. I don't want to do step 10. And I'm guilty of that. I mean, I've been practicing for over 30 years, so I have pretty strong opinions about what I want to do and what I don't want to do. But we have to recognize that to get the treatment outcome that was achieved in research, if we don't follow that exact protocol, we might not have the same exact outcome. So my recommendation would be, especially if you've been practicing as long as I have or have the same feelings I do, is to do the research protocol method and see how the client feels. And be like, okay, next week when you come back, I want to do this research method and I'm going to slightly tweak it and see if we can get even better results and compare the two. Ask the client, does it feel better this way or did you feel better the way I worked last week? And then you can continually tweak based on client feedback. If the client isn't tolerating what you're practicing from research, or maybe you even tweaked it or added or took away a step or something like that, and the client's really not comfortable, you should stop that immediately. Whenever your clients are uncomfortable, we should change what we're doing to make them more comfortable. Clients should never be uncomfortable on our table because that is something that releases cortisol, our stress hormones and stuff like that. And then we have all types of negative reaction when we don't feel good inside our bodies. And massage is not necessarily supposed to hurt. It's supposed to help clients feel better and feel good, okay? Sometimes you'll be doing deep tissue or trigger point, and I'm okay with one of those hurts good. I'm not okay with hurts bad. So whenever anything hurts bad to the client, I stop immediately and I try and adjust to make them comfortable. So to be clear about using research to create new massage techniques and protocols in a medical massage practice, this is not a green light to use anything you find in research. Some of the research is going to show no benefit and it could even show negative consequences. So make sure when you're finding these research studies to apply on your client, you find something that has positive treatment outcomes similar to what the client is seeking. Practitioners need to consider the entire study when looking for researched methods to practice at your own establishment. Obviously, you should read the entire text and not just an abstract of a research study to practice it on a real client. The full study will give you the best information as to whether or not it's appropriate work for your client. It will give you information such as if you're working on a disease like arthritis or fibromyalgia or migraines or whatever, how long they've had this disease, like the disease onset. And then also, if it does have hands-on methods, it might tell you how many times the client is to receive this hands-on protocol. That's important too, because a lot of these research studies, they've had multiple appointments. It will also tell you in the full study the frequency of the appointments, depending on the quality of the study. The better quality studies will have all of this information. So you might say the study has a 60% improvement rate for clients with migraines, but those clients had 6 weeks of service. So you need to share that information with your client as part of an informed consent process of, I found a researched hands-on protocol for clients with migraines. It's for 40-year-old women just like yourself. And I really want to do this with you. These are 30-minute appointments, but I need to see you twice a week for 6 weeks. they had a 60% favorable outcome with the study. Do you want to try it? You can print off the study, show it to your client, show it to them online, share a URL link to their email address or text. These are great ways to practice from research in a medical massage practice. The study details will vary from one piece of research to another piece of published research, but again, you should be trying to read an entire research study before applying it on your own clients. The abstracts will have the least information of all, so please try and find full studies before attempting to apply. The full text of a research study will show if candidates were rejected and why, the reasons they were rejected most times. That's really important information, because if your client has the same reason for rejection, then of course you want to apply that study and hands-on method to them. So please make sure you're reading the whole study before attempting to apply the methods to your client. The reasons why participants might be disqualified from a study could also be because the participant didn't want to receive it. I know that there's some oncology studies out there where they approached over 1,000 people receiving chemotherapy, and less than 1,000 people accepted the service, the hands-on method. So in that case, there was no medical disqualification. It was simply because participants opted out from being included within the study. So these are the things that you need to read to learn to determine if this would be an appropriate research study to try and emulate with your paying client. There are many little details that you'll need to consider to apply this research to your client. I hope this gave you some of the best considerations to make. Let's move on. Right now, I'm going to share with you a little bit more about the research process before we start our hands-on practice, because it might be easier to follow the research with hands-on protocols when you do have that understanding. In the 5 CE Hour Medical Massage course, I will give greater information about this at the end of the training, about different types of research studies for massage application. Reading these research studies and following them sometimes takes a little bit of interpretation on your own, especially when they were not published in English as a first language. Sometimes they're incomprehensible, so you can't follow them. Sometimes they need a little bit of interpretation on your behalf. And again, if you're already trained in the subject, you should have no problem doing that. The problem is some of the research studies can be of low quality and they're not concise, and then you're going to have to make the determination if you can safely follow the study. Practitioners should never discount a study simply because they think it's of poor quality, and I've seen too many people do this. In massage practice and research, I've seen a lot of comparisons where they'll compare something like sports massage to kinesiology taping or something like that. And I'm going to still read that research. I'm not going to discount it simply because it's a comparison study. And some people do, and that just doesn't make sense to me. Yes, it would be nice if we had sports massage studied all by itself, but a comparison can still have some valuable information in it. I would read, if I want to practice a sports massage, what techniques were applied to have certain therapeutic outcomes. And then I would apply that to my athletes. That's valuable information. You might pick up some new applications that you forgot about from your training or what have you. Maybe you're doing it in a different sequence for different time lengths and different frequencies with the client and so forth. All of that information can be obtained from research studies. Some of them will have that information, some won't. But if it's a comparison study against, taping, who cares that it was a comparison? Read that information. If you saw a positive outcome for the sports massage group, there's no harm in using it. It might be effective and the key that you need for your clients. I'm very grateful that the National Library of Medicine, PubMed.gov, exists with our taxpayer dollars. It's a great free resource to continually look up new research methods. They're continually posting new data as time goes on and more publications come out. It's great for new practitioners who need a little bit extra information, and for older practitioners like myself, where I do so much these days, I could possibly forget some applications, or let's say I run out of ideas. Who do I get my training from, right? I've done just about every class out there, but it's great to see research that was conducted in Spain or Russia or London or what have you. And I'm always learning, always from research. Unlike the pharmaceutical companies that are these multi-billion-dollar conglomerates that make more the more medications you purchase or what have you, they have huge budgets for research to get their medications approved to sell to the public for public consumption or more and more. So their research studies are usually of better quality than the massage industry and massage modalities. We have very little funds for research, but that shouldn't discount our research studies just because they're not of the pristine quality of the pharmaceutical companies. Sometimes they are, but oftentimes they're not. Don't get discouraged. I believe over time our research studies will continue to improve in all industries. There are a lot of researched methods that are already published. What I'm finding is sometimes a study will pop up on PubMed.gov that I haven't seen before, but it was published 7 years ago. You know what's happening, or what I believe is happening, is I think with AI interfaces, some of these foreign language journals are being translated into English, and voila, it ends up on PubMed.gov. So we're getting more and more old research because of artificial intelligence and all that industry that's happening to get greater and greater information out there. And also we have new research studies happening all the time, which are continually being published at pubmed.gov. There's a lot more to practicing from research, but I'm going to try and wrap this up really quickly because I want to get some hands-on practice here and show you how to practice some of these published hands-on protocols from research. Obviously, the better versed you are in the research process, the easier and quicker you will be able to interpret a study and execute it in real-time practice. You'll also, over time, also be able to determine what are poor quality studies and what are better quality studies, and then practice what you see fit. Even learning how to collect this data, the different keywords you'll use to search in PubMed.gov, that's a skill. And the more you practice it over time, the quicker and more efficient you'll become with it as well. Practicing from research can be pretty intensive and an extensive process because sometimes you can spend a few hours looking for something that might not exist yet. Okay, but I have seen people that are almost like walking encyclopedias. Fortunately, now that might be a little bit me, but 10 years ago, I had some practitioners in my life where I would reach out to them and say, hey, have you seen this practiced in research yet? Are they doing these reflexology techniques, or have they used aromatherapy for this, or Abhyanga or Shirodara or what have you? And it's really nice to have that foundational background about what's been proven in research, what methods have been researched for efficacy. It's great knowledge to practice from. Massage therapists and overall healthcare providers have an extremely high burnout rate in our industries. So when you're practicing something new and practicing from research, you've got this background and foundation supporting you. Hopefully that will give you new energy and vigor for your practice. I think just about all research is valuable unless it's erroneous or falsified. And I say that because let's say you have a research study that showed no positive outcome or even a negative outcome. Do you think you're going to apply those techniques to your clients? Of course not, right? So let's say they were studying people with scoliosis and they tried these techniques and there was no positive outcome. Now you can eliminate something that you would have done with your scoliotic clients because in research it was proven to be ineffective. Using research will help advance your practice more quickly than without. Therapists that use these researched medical massage practices have an improved quality to them. It's almost like it can create a do's and don'ts list with your hands on practice. You'll know which researched methods were effective, and you've also learned which researched methods showed no result or even a negative result. So you have information that other massage therapists might not have, and that's definitely going to make you a better practitioner. We've spent almost 45 minutes here reviewing all types of different ways to use research to enhance your practice. I hope you've enjoyed this free lesson. I did reference throughout the training that we're going to move on to hands-on training, which we will do in our paid coursework. This was just the kind of intro video to get students started before we do the hands-on practice, which is available in our 5 CE hour medical massage class that you can take at our school. If you're interested in continuing this training and would like to register for it, please go to ceinstitute.com, and if you search in the search bar 5 CE hour medical massage, the whole course will come up, not just this intro video that you've just watched, with all the hands-on practice, watching me apply researched methods to clients. So again, I hope you enjoyed. Thank you so much for sharing your time with us. We hope you've learned some valuable approaches on how to enhance your practice. Until we see you in a training, be safe.